Let us now learn about muscles of mastication. These are group of muscles concerned with movements of mandible at temporomandibular joints during mastication. They are concerned with movement of mandible at temporomandibular joint during mastication. The principal muscles of mastication include temporalis, lateral pterygoid, medial pterygoid, and masseter. Temporalis, lateral pterygoid, medial pterygoid, and masseter. Characteristic features of muscles of mastication. Action. All the muscles of mastication act at temporomandibular joint. They all act at temporomandibular joint. Location. They are located in temporal, parotid, and infratemporal regions. Temporalis is located in temporal region. Masseter is located in parotid region. Lateral and medial pterygoids are located in infratemporal regions. Insertion. They all are inserted into ramus of mandible. You can see all the muscles are inserted into ramus of mandible. Now supply. All the muscles of mastication are supplied by only single nerve, that is mandibular nerve. Development. They all develop from mesoderm of first pharyngeal arch. All the muscles of mastication act at temporomandibular joint, inserted into ramus of mandible, supplied by mandibular nerve, develop from mesoderm of first pharyngeal arch, located in temporal, parotid, and infratemporal regions. Let us now learn about each muscle of mastication in detail. First, let's see about temporalis. Temporalis is fan-shaped muscle. It is situated in temporal fossa. It is covered by temporal fascia. You can see that the temporalis is located in temporal fossa. It is covered by temporal fascia. Origin of temporalis. It arises from floor of temporal fossa, except the part formed by zygomatic bone. It also arises from deep surface of temporal fascia. You can see here, this is floor of temporal fossa. Temporalis arises from floor of temporal fossa except the part formed by zygomatic bone. It also arises from deep surface of temporal fascia. Insertion. The fibers of temporalis pass downwards and gets inserted into medial surface, tip, and anterior border of coronoid process. It also gets inserted into anterior border of ramus of mandible. You can see here, temporalis is getting inserted into medial surface, tip, and anterior border of coronoid process. It also gets inserted into anterior border of ramus of mandible up to last molar tooth. Temporalis arises from floor of temporal fossa, deep surface of temporal fascia, gets inserted into conoid process and anterior border of ramus of mandible. Let us see nerve supply and action of each muscle later. Masseter. Masseter is quadrilateral muscle. It covers lateral surface of ramus of mandible. Masseter has three layers: superficial layer, middle layer, and deep layer. Out of the three layers, superficial layer is the largest layer. Origin of masseter. It arises from zygomatic arch and maxillary process of zygomatic bone. Superficial layer. It arises from maxillary process of zygomatic bone. Anterior two-thirds of lower border of zygomatic arch. You can see here zygomatic arch. You can see that the masseter is attached to the lower border of the zygomatic arch. Superficial layer arises from anterior two-thirds part of lower border of zygomatic arch. Middle layer arises from posterior one-third of lower border of zygomatic arch. Deep layer arises from deep surface of zygomatic arch. Superficial layer from maxillary process of zygomatic bone and anterior two-thirds of lower border of zygomatic arch. Middle layer from the posterior one-third of lower border of zygomatic arch. Deep layer from deep surface of the zygomatic arch. Insertion of masseter. Masseter gets inserted into lateral surface of ramus of mandible. You can see this is ramus of the mandible. The masseter gets inserted into lateral surface of ramus of mandible. Superficial layers, they pass downwards and backwards and gets inserted into lower and posterior part of the ramus of mandible. Lower and posterior part of lateral surface of ramus of mandible. The fibers of middle layer passes vertically downwards and gets inserted into middle part of lateral surface of ramus of mandible. Fibers of deep layer passes vertically downwards and gets inserted into upper and anterior part of lateral surface of ramus of mandible and coronoid process. The fibers of deep layer gets inserted into upper and anterior part of ramus of mandible and its coronoid process. Lateral pterygoid. Lateral pterygoid is short, thick, conical muscle. It has two heads, upper head, lower head. You can see the upper head is smaller, lower head is larger. It has smaller upper head and lower larger head. Origin of lateral pterygoid. Upper head arises from infratemporal surface and infratemporal crest of greater wing of sphenoid. Lower head arises from lateral surface of lateral pterygoid plate. You can see the upper head of the lateral pterygoid here. It arises from infratemporal surface and infratemporal crest of greater wing of sphenoid. Lower head arises from lateral surface of lateral pterygoid plate. This is lateral pterygoid plate. Lower head of lateral pterygoid arises from lateral surface of lateral pterygoid plate. Insertion. The fibers of lateral pterygoid passes backwards and gets inserted into pterygoid fovea on anterior surface of neck, articular disc and articular capsule of temporomandibular joint. You can see here the fibers are passing backwards and getting inserted into pterygoid fovea. Pterygoid fovea is present on the front of neck. Neck of the mandible is present just below the head of the mandible. On the anterior surface of neck, pterygoid fovea is present. Lateral pterygoid gets inserted into pterygoid fovea and articular capsule and articular disc of temporomandibular joint. Medial pterygoid. It is quadrilateral muscle. It has two heads, superficial head and deep head. You can see that the superficial head is smaller, deep head is larger. Small superficial head, large deep head. Origin of medial pterygoid. Superficial head arises from maxillary tuberosity. Deep head arises from medial surface of lateral pterygoid plate and pyramidal process of palatine bone. You can see this is superficial head. It arises from maxillary tuberosity. Deep head arises from medial surface of lateral pterygoid plate. Both the lateral pterygoid and medial pterygoid arises from lateral pterygoid plate. Medial pterygoid arises from medial surface of lateral pterygoid plate. Lateral pterygoid arises from lateral surface of lateral pterygoid plate. Deep head arises from medial surface of lateral pterygoid plate and pyramidal process of palatine bone. Insertion. Medial pterygoid gets inserted into medial surface of ramus of mandible. You can see the ramus of mandible. Medial pterygoid gets inserted into medial surface of ramus of mandible. In the medial surface, it gets inserted into posterior inferior part of medial surface. And it also gets inserted into angle of ramus of mandible. Onto the lateral surface of ramus of mandible, masseter is attached. To the medial surface of ramus of mandible, medial pterygoid is attached. Now supply of muscles of mastication. All the muscles of mastication are supplied by mandibular nerve. You can see here, this is main trunk of the mandibular nerve. It divides into anterior division and posterior division. Out of the four muscles, only medial pterygoid is supplied by a nerve that arises from the main trunk of the mandibular nerve. Remaining three muscles are supplied by the nerves that arise from anterior division of mandibular nerve. Temporalis, it is supplied by deep temporal nerves that arise from anterior division of mandibular nerve. You can see here deep temporal nerves, they arise from anterior division of mandibular nerve. Masseter, it is supplied by masseteric nerve that arises from anterior division of mandibular nerve. Masseteric nerve arises from anterior division of mandibular nerve, supplies masseter. Lateral pterygoid, it is supplied by nerve to lateral pterygoid that arises from anterior division of mandibular nerve. Nerve to lateral pterygoid arises from anterior division, supplies lateral pterygoid. Medial pterygoid, it is supplied by nerve to medial pterygoid that arises from main trunk of the mandibular nerve. You can see the medial pterygoid, it is supplied by nerve to medial pterygoid that arises from main trunk of the mandibular nerve. Actions of muscles of mastication. Depression caused by lateral pterygoid. The only muscle that causes depression of mandible is lateral pterygoid. Depression of mandible causes opening of mouth. Depression is caused by lateral pterygoid. Remaining three muscles causes elevation of mandible. Temporalis, masseter and medial pterygoid causes elevation of mandible. Elevation of mandible closes the mouth. You can see here, temporalis causes elevation of mandible, medial pterygoid causes elevation, masseter causes elevation, whereas lateral pterygoid causes depression of mandible. Protrusion of mandible. Protrusion of mandible. It is caused by medial pterygoid and lateral pterygoid superficial fibers of masseter. Lateral pterygoid, medial pterygoid, and superficial fibers of masseter causes protrusion. Retraction is caused by posterior fibers of temporalis. You can see here temporalis causes retraction of mandible. Let us now revise muscles of mastication. First, let's see origin and insertion of muscles of mastication. Temporalis, it arises from floor of temporal fossa and temporal fascia. It gets inserted into coronoid process and anterior border of ramus of mandible. Masseter, it arises from zygomatic arch and maxillary process of zygomatic bone. It gets inserted into lateral surface of ramus of mandible. Lateral pterygoid, it has upper head, lower head. Upper head arises from infratemporal surface, infratemporal crest of greater wing of sphenoid bone. And lower head arises from lateral surface of lateral pterygoid plate. Insertion, it gets inserted into pterygoid fovea, articular disc, and articular capsule of temporomandibular joint. Medial pterygoid. Medial pterygoid, it has superficial head and deep head. Superficial head arises from maxillary tuberosity. Deep head arises from medial surface of lateral pterygoid plate and pyramidal process of palatine bone. It gets inserted into medial surface of ramus of mandible. Let's see now supply. Temporalis, masseter, and lateral pterygoid are supplied by branches that arise from anterior division of mandibular nerve. Medial pterygoid is supplied by a branch that arises from main trunk of the mandibular nerve. Next actions. Only muscle that causes depression of mandible is the lateral pterygoid. Elevation is caused by temporalis, masseter, and medial pterygoid. Retraction is caused by posterior fibers of temporalis. Protrusion is caused by lateral pterygoid, medial pterygoid, superficial fibers of masseter.